Nasal polyps are the outgrowths in our nose, which can often grow large and block nasal passages. As a result, we have difficulty in breathing. The nasal cavity refers to the hollow space in our nose. The lining of the nasal cavity is made up of mucosal cells. The lining of this nasal cavity is made up of mucosal cells which secrete mucus, due to which air gets moist while breathing. Besides, this mucus also trap germ and dust particles. But due to allergic or infection, inflammatory mucosal lining occurs. Due to allergy or inflammatory actions, mucosal lining occurs. And when this inflammation gets chronic and outgrowth starts, which is termed nasal polyps. When polyps are small, they are usually no symptoms, but at that time they don't obstruct the airways. However, as they develop in size, they cause breathing difficulties. Hence, the removal is needed and should be performed. So, if they not shrink with medicine or they grow too big, surgery is performed. So, surgery is performed. The process of nasal polyps removal is called a polyectomy. The patient, first of all, the patient is given general anesthesia, and medicine, before this medicine is given, treated. If it is not treated, a surgical operation is needed. For that, the patient is given general anesthesia. After that, surgeon insert a tube in the nose which has a camera and blade at the tip. So like this, the polyps are removed from the from our nose. In this picture, clearly shown how the polyps grow and how they develop, and what are the difficulties, and when they grow, especially we get a lot of sneezings, and it causes to what I say, that is sinusitis. So sinusitis, when do we say? When it is in severe, chronic. Why this happens? Because polyps are stout, as the shown in the picture. So in that case, surgical method is the only solution to remove the polyps. Clearly see in the pictures how the polyps grow, from normal size to big size, when it is impossible to remain with a calm, that's what I say. So how this nasal polyps are removed, is clearly explained through you. So whenever nasal polyps are grown, try to get surgical operation. Don't neglect it, and it is shown how easily it is. Within 1 hour it is done, and doctor discharges you by giving some tablets, medicine. So let the polyps not grow larger, and let your breathing be safe and passage. I hope you have understood how polyps suffer a man, and how they are removed, and what you should do if the polyps are grown in your nose. And thank you, and subscribe my YouTube channel, Robert Stephen James Pre